550 KTRS. So last week, I had a chance to meet our next guest, and I peppered her with a million questions because I just didn't get it. And she answered them all, and I said, can you come on the show because more people need to hear this story. Annie Farley joins us. Annie, welcome to Big 550 KTRS.
Thank you, McGraw.
You are co-owner and coordinator of a medical place called TMS Wellness Center, and you have spent your professional career in the mental health field, correct?
Yeah, absolutely. I'm going to date myself, but 20 years.
20 years. And this TMS Wellness Center is brand new, and it is, the best way to explain it is it helps people who have depression with MRIs. Is that as simple as it gets?
It's the same technology as an MRI.
Right.
Absolutely.
Right.
And it's a device that literally helps stimulate the areas of the brain that are not connecting, underlying where depression generates from in the prefrontal cortex.
Now, when you said that to me the first time, I thought to myself, what kind of witch doctor thing is this? Because it sounds science fiction, because depression, you hear all the terrible stories of the people who are on drugs, so this isn't working and that's right, and they have different drug cocktails trying to regulate what's going on in their brain, and then comes along this MRI technology with help. So take us back to the beginning. What's going on with this?
Sure. That was exactly the problem that drove looking for another alternative to treat people with depression. They're taking medications. They've got all these side effects. If the medications are working, you're talking about people who are making it through their day, right, versus really having solid quality of life.
You also have people who are choosing not to take the medicine for all sorts of reasons.
Absolutely, because they didn't have an alternative that was really benefiting them.
Right.
And I think it was just that in terms of psychiatry, there were not a lot of options. And this is a newer science and way of really treating the cause of depression at the root of depression. And it targets specific sites. It doesn't create all those side effects. Not only that, but we can get people beyond just making it and get them to a place where they have legitimate quality of life that oftentimes they have not experienced in years.
How long has this been around?
So the FDA approved it in 2008. Okay. In terms of the St. Louis area, I actually was part of opening the first clinic that took commercial insurance, and that was approximately 3 years ago. So during that time, I've been part of treating close to 300 patients, and I have seen remarkable change in those people.
Now, explain to people how this works. They go to your office, and what happens?
They come to the office. We do an assessment. We talk to them about what has the course of their depression looked like, what have they tried, what has worked, but to what degree has it worked, and what has failed for them. And we establish, are you appropriate for this treatment? Can we help you? Can we benefit you with it? And then we literally will fight for them to be able to get that treatment through their insurance. If we can't help them, we will help them find, whether it be counseling, whether it be different psychiatrists, different groups, means by which they can still work towards getting better.
Does this have to be prescribed by a psychiatrist?
It does have to be prescribed by a psychiatrist. So the physician that we work with, who is also an owner, right, and very, very dedicated to mental health, over 20 years of experience, is Dr. Howard Ilovicki.
Right. And now, he was in the trials for this?
So back in the beginning, and that's a very interesting point, when TMS was in development prior to FDA clearance, he was able to get some experience with that very early on. I don't think most people have that to bring with them, right, into this particular field.
Right. Okay, so you have the guy who helped invent it. Create it.
Who worked with it in the beginning.
Who worked with it, right? Who was there, who's now here. And we said it's an MRI technology. And this is interesting. So somebody comes to you who's suffering from depression. They're taking their medication, either taking it, not taking it, varying degrees of success.
Absolutely.
What does this MRI technology do?
So what it does that is different from other things is that it directly stimulates the area of the brain that is non-responding. If you've got underlying conditions that have prevented you from making those healthy chemicals that you can then participate well in counseling, or your medication can then work on to benefit you. If you're not making that and those connections are not there, how are you really going to get better? So this is actually addressing the root cause. The device itself is placed right at the frontal part of the head.
Right.
It uses MRI technology to penetrate and stimulate those nerve cells in the front portion of the brain itself.
Right.
So there's no medication, there's no systemic effect. There's literally, at best, some headache, maybe some discomfort at the treatment site, but your side effect profile just isn't there. The number one risk is it doesn't work.
Okay, we'll get to that in a second. So you're saying it doesn't hurt in any way, shape, or form, this MRI?
Correct. There is some discomfort at the treatment site. I've never had anyone stop treatment as a result, but that's about it.
Okay, in terms of it working or not working, what are the results? Show.
So in my experience, if you look at the trials for the FDA clearance, they're saying 33% remission and 60% responding. However, that was in 2008. We have been able to find things that can really amplify that response. So in my personal experience, we're a little above the 50% on remission, and really closer to 70, 80% responding.
So in other words, 70 or 80% are better, 50% are really better.
Correct.
Now, it's so fascinating. And I quite frankly, I wouldn't believe you unless, since it's covered by insurance and FDA approved, those are the stamps of approval, more or less, right? I mean, that's where this is clinically proven. This has gone through the trials, the tribulation. This is all the things one needs to know before they even make a decision like this, I would think, right? I mean,
yes, absolutely. And you can contact your insurance provider and they will tell you, we cover this.
Right.
There are very few insurances out there that don't, because it is a non-invasive, safe way to attack depression from a different point of view, from, from the root.
How does it work? Because explain how long the treatment lasts and how that works.
The easiest way to explain it is we are literally taking that portion of our brain out and working it out for the first time in a long time. So I compare it to a muscle. We have to build up the strength and the response in that muscle. To do that takes repetition. The standard course of treatment is 5 days a week, and that's for 4 to 6 weeks, depending on how fast you respond.
Right.
You're in and out 29 minutes to 45 minutes, somewhere in there, in terms of your treatment, and that
So
depends on
half
how you
hour.
tolerate it. Yeah.
Right.
You drive, nothing changes in your life. You take the same medication, you sleep the same, you eat the same. We're not asking, that you're sedated or any of those different things
So
that might come with other
you're not knocked
treatments.
out. Nobody has to drive you. No one has to drive you home.
No. Drive yourself in, get the treatment, head on about your day.
5 days a week for 4 to 6 weeks.
Correct.
That seems like an awful big commitment.
It is a big commitment. When I first started doing TMS, my thought process was, who is going to do this? And my experience has been that 90% of the individuals I've worked with finish that course of treatment. You don't do that. You don't make that kind of commitment if you're not getting anything out of it.
Yeah.
Because it's asking a lot of your life to do that. And I have people travel from pretty far distance away.
Your offices are on Highway K in O'Fallon?
O'Fallon, yep.
O'Fallon. Highway K in O'Fallon, right off Highway 40. And you have people come from all over. Southern Illinois, 20, 30, 40 minutes away every day.
Yep, absolutely. It's worth it to them.
How long do you do this every day until you start to see results?
It varies based on how chronic the illness has been, how long you have been depressed, and whether you've ever responded before. Typically, patients, family members, and support systems start to see some change around treatment 10. The individual can be anywhere between treatment 10 and treatment 20. But when it happens, it's like that light comes on. I was driving this morning, it's foggy outside, and I can barely see. That moment where that sun breaks through and everything clears up, that's what it feels like. And then they are committed. They come back. It's something they haven't experienced in years.
Once you've completed the 4 to 6 weeks and the fog is lifted, do you ever have to go back?
And that's very individual also. This is not a cure. There is I call it the work of being well. You have to continue to, whether it's taking a low antidepressant, but stay on your medication, see your psychiatrist, commit yourself to counseling. It's a whole picture in order to not fall back into depression.
Right.
There are some people that do come back and some people that don't.
So some people don't need it. Some people do. Is all individual.
Correct.
Yeah. But the ones in which it works,
it works.
It works. You explained it to me as creating the neurons, and I'm not going to get the other science right, but the receptors in your brain are sort of blocked, and the drugs can't get to those receptors. And this MRI technology, whatever it does, sort of creates the mechanism for those receptors to receive the drugs.
Absolutely. Absolutely. You've got to have those chemicals, serotonin, dopamine, norepinephrine, those chemicals that the drugs work on have to be present. So if we've got, think of it as a lethargic nerve,
right.
We're not producing what chemicals we need for the drugs to work on. So the messages between those nerve spaces are disrupted.
Right.
And what that leads to is getting back into those centers of our brain that cause anxiety, that make us feel pleasure. That communication is also disrupted.
Right. So do people, once they go through the TMS program, when they're working with their psychiatrist, will their psychiatrist oftentimes probably change the dosage or change the drugs depending on whatever, because now it's working in a different way?
Absolutely. Yeah. So we do see people in particular who are able to reduce the medication that they're taking for sleep, that they're taking for anxiety, that they're taking for some of those symptoms that go along with depression.
Right.
They're able to cut back those doses of some of those medications. And as a result of that, experience less side effect.
Gotcha. All right. So there are people listening now who have a million questions, and we'll tell them how to get a hold of you. But do they have to go to their psychiatrist first? Can they call you directly? Do they have to? I mean, how does all this work?
They can call directly. I always recommend that you talk to your psychiatrist. This should be a relationship in which the provider works with us. It's the best for your care. If you want to know if you qualify and you want to know if you're the right candidate, we will do a free consultation with you.
Right.
We will evaluate you. If you're not seeing a psychiatrist, that's what Dr. Ilovicki's for, and
Right.
he's fantastic, so he can help determine, is this a good treatment for you as an individual?
Right. So somebody who's working with a psychiatrist, certainly call your psychiatrist and ask them about this TMS, right?
Absolutely.
Or if you are or not, or you want a second opinion, or you want to find out more, you have a psychiatrist on staff to help with all of these questions.
Absolutely.
So basically, if you have questions and you're interested,
Yep.
call and you'll figure out the best course of action.
That's right. I mean, we're committed to helping people not be depressed.
Yeah. And it's FDA approved,
Yes.
and all major insurance carriers cover it.
Yes.
And Medicare.
Yes. And Medicare.
Science fiction is what it is, right? I mean, somebody who spent 20 years in this field, this must be amazing for you to see.
It is. It's extremely rewarding, which is why I decided to go into this specifically.
Right.
I've loved mental health from the beginning, but
Right.
I have seen more people's lives changed as a result of this treatment
Right.
than anything else I've been a part of.
And again, I'm going to get the science wrong, but there's all sorts of depression, and that's sort of the overview. But there are people who have bipolar or schizophrenia or whatever else. I mean, all of that encompasses this?
So TMS is approved, FDA approved for the treatment of depression, major depression that hasn't responded to other therapies to the point that the individual is really in remission.
Right.
There are a lot of studies out there. a lot of them, in which they are looking at treating different conditions, and they're getting really good results. It's just not something the FDA has approved yet. So those
Gotcha.
are considered off-label.
Gotcha. But the clinical term depression, I don't know, is that considered a clinical term?
Yes, major depressive disorder is the diagnosis.
Point is this, call you, right?
Yeah.
Any questions, call
Yes,
you.
Call.
The phone number, 314-497-9657.
That is correct.
314-497-9657. The name of the company is TMS Wellness.
Yes.
It's on Highway K, right off of Highway 40 in St. Charles. St. Louis, TMSWellness.com. St. Louis, ST Louis, TMSWellness.com. 314-497-7657.
9657.
I knew I was going to get it wrong.
That's all right.
314-497-9657. We will give this number to the administrative assistant at KTRS. So when you call, if you missed it, we'll also put it on the web and, of course, your website, St. Louis, TMSWellness.com, for people to get a hold of you. Thank you for coming in. Good luck.
Thanks for having me.
925 here. Big